Hi, I'm Caroline Elizabeth Jimenez, and this is my laryngeal model demonstration. I'm going to start off by talking about the anatomy of the larynx first. And this is the cricoid, which is a ring-shaped cartilage of the larynx. And then this butterfly-shaped gland right here is the thyroid. It's a large ductless gland in the neck that secretes hormones regulating growth and development through the rate of metabolism. Then these green triangles right here are called the arytenoids, which are a pair of cartilages in the back of the larynx. The epiglottis, which is the flap of the cartilage at the roof of the tongue, which is depressed during swallowing to cover the opening of the windpipe. Then these right here are the vocal cords, which are folds of membranous tissue that project inward from the sides of the larynx to form a slit across the glottis in the throat, and their edges vibrate the airstream to produce this voice. Then we have the trachea, which is the large membranous tube reinforced by rings of cartilage extending from the larynx to the bronchial tubes, and they convey air to and from the lungs via the windpipe. Then I'm going to go ahead and I'm going to talk about the structure of the larynx, which it is about 5 centimeters or 2 inches long. It is divided into 3 regions. The top is called the supraglottis, which is, I guess, right up here. And then we have the glottis, which is the middle part. And then we have the subglottis, which is down here. The supraglottis at the top of the larynx is the main structure of the supraglottis. The flap of the movable cartilage is called the epiglottis. The glottis, which is in the middle, contains the vocal cords, sometimes called the vocal folds, and there are a pair of muscles on each side. And then the subglottis at the bottom of the larynx is between the glottis and the trachea, or the windpipe. To talk a little bit about the physiology of how this all works, so for swallowing, the muscle and ligaments of the larynx help move food from the mouth to the esophagus, and when you swallow, this top flap folds over to cover the top of the larynx to stop food or liquid from entering the trachea or the lungs. They are also used for speech. So for speech, the vocal cords move back and forth and vibrate, and this creates the pitch or the sound. And as you push air up through the larynx and through the mouth, you create different sounds of speech by moving your teeth, tongue, and lips. And then to show you the model a little bit better. And then this piece moves up and down as the glottis would, and then these are the vocal cords that vibrate back and forth. And then these, the arytenoids, move back and forth also. And that's my model.